We're so thrilled because right now, joining us via Skype, we have one of our regulars here on the show with us, Vince Redmond. He's a licensed marriage and family therapist, but beyond that, Vince was somebody who did therapy in the ABA field with people on the autism spectrum for many years, I think 2 decades, over 2 decades. Over 2 decades. Thank you, Vince. And so now he's a licensed marriage and family therapist, so he's able to give us insight that is just absolutely brilliant. And we once a month, we ask Vince to come in and talk about a topic with us. And this month, the topic is when we're having aggressive behavior from our kids. Yeah. It could be hitting, it could be kicking, it could be biting. Scratching.
Scratching is another one.
There are all kinds of things
hair,
that can happen.
Grabbing.
Yes, all kinds of things. And one of the things that we want Vince to talk about is emotionally, this is really hard.
Yes.
And that a lot of times we keep it secret. We don't want it because there's shame and guilt.
I used to cover up the bite marks and scratches on my arms with makeup.
Yeah. And that's not, you're not the first person that we've heard that from.
Right.
So Vince, welcome back to the show. We're so thrilled to have you, and thank you for taking on this difficult topic with us.
No problem. And very difficult, like you said. I mean, the emotional connections, the emotional reactivity that parents have to, when they have a child that has aggression can vacillate, right? It can be anywhere from, fight or flight, where they go in and they want to do something right away with it, or again, they cover it up and they really go into more self-protective mode. It's a very sensitive topic, but actually very real. There's a lot of our kids, a lot of our families that are dealing with this on a day-to-day basis. And I think one of the things that we want to continue to do is make sure that we're looking at the family's needs just as much as we're looking out for the kids' needs.
Yeah, and I think maybe one of the things I want to start with, Vince, is that a lot of times we get lulled into this thing where we go, well, this is just my new normal. My kid has autism, so from time to time this is going to happen, and we just sort of accept it as the status quo. And we really shouldn't do that, correct?
No, we need to change that, right? We need to change that status quo. I mean, that's the whole idea why we're here, right? We're here to change the behaviors. We're here to change the child's, outlook on life, to make sure that we're giving them every probability to be successful. And the first thing we have to do is actually mediate and replace these behaviors with more functional, adaptive ones. And, I know that sounds very easy, but it's actually very difficult to do, as, all the families that have aggressive children are very well aware of. And it's something but it has to take priority. It's not something that we can set aside. It's not something that other skills that the child's going to gain are going to replace. We have to teach them better coping skills. We have to find the root, the function of the behavior. Where is that coming from, and try to replace it with a more appropriate way of doing things, so that their anxiety and their anger and their aggression goes down, while they're finding different ways to be able to get their needs met. Either it be through maybe sensory intake, maybe it's, getting different sensory inputs, appropriate ways, or maybe using their language to be able to share their wants and desires. Whatever it may be, we have to find the root to it, the function to it, so that we'll be able to help it. But we have to do that as a team. We have to do that as a we. It's the families and the parents and the extended family just as much as it's the therapist and the supervisor. We can't do it alone, just as the family shouldn't be able to tackle it alone.
And that's hard. Sometimes it's hard for, when we are able to be honest about it and say something is going on and the intervention starts. Sometimes that's really hard for the families because there is an emotional thing that's going on as well. There's an emotional component that sometimes, I think it's really common, and we have to speak very frankly about this. Sometimes we get into a mode, I certainly did this, when my son was punching me in the head and he wasn't punching anybody else. Right. I got into the mindset of, well, clearly it's my fault.
Right.
Clearly I've done something. And so, there's this scary little thought where you go, well, I should just take it then. Mm-hmm. And that's the dangerous sort of tipping point. I think it's different for all kinds of people, but getting into that self-blame, taking it on, and not feeling, because part of it is we don't want to blame our kid.
Right.
And you got to blame somebody, right? Because
Right.
that's what we're trained to. And we don't want our kid to be a monster
Right.
who punches us or scratches us. So it must be my fault. I'm bad. And oddly enough, Vince talked to this about that prevents us, thinking like that prevents us from being able to follow through to do the thing that will stop it.
Right. Well, and a good trick could be, I mean, again, this is a suggestion, is blame the autism. It's not the child, it's not the parent, it's the disorder. That's the reason why that he's doing the behaviors that he's doing. And when we can personalize that to something else, give it an entity, now we can aim our targets, we can aim our interventions, we can aim our resources at change, let's say defeating that target, right? Defeating the autism, going and making sure that we are learning the right strategies. I think one of the things, and you had mentioned that, kept me thinking, was a lot of times we retreat when our kids are getting aggressive, right? We kind of keep it more in-house. We try to keep it away from other people, not only keeping the aggressive behaviors from other people, which is understandable, but we don't talk about it much with everything. And we actually need to do the exact opposite. This is where we need that village. This is where we need that community. This is where we need people to help, right? Parents should not be tackling this alone. Use your professionals, use your extended family, use neighbors, right? Whatever the case may be, we need to rally around each other to support each other with obviously the professional guidance as well.
And there's a lot of
I'm sorry, go ahead. We feel we want to retreat. We feel we want to keep it to ourselves, when in fact we really should be reaching out to support.
Okay. Yeah, you got to reach out and let people know what's happening.
Right.
But then as the intervention starts, it's one of those things that it's really, really tough, and I think you got to be kind to yourself. I just know from my personal experience, the first time that I said something to somebody, I kind of soft pedaled it.
Yes, I did too.
Right?
And because you're ashamed, really. There's a lot of shame attached to this.
And I didn't want them to look at my child in a different way,
right.
So I kind of was like, yeah, this is kind of going on. And they didn't see the urgency because I didn't share it. Mm-hmm. Then I came back, and the next time I had a clinic, I was so afraid that, and I've told this story before, that I came in and I said, I can't leave until you give me some help. And they got me some help immediately. But as they were trying to help me, and it was two of the nicest people on the face of the planet trying to help me, I got so upset that at one point I just started yelling at one of them because he was trying to show me what to do when I was putting Jem into his car seat. Mm-hmm. And he was going through it, and it all made sense to him. And I just started yelling at him, going, where is my purse in this scenario? Don't bother showing me how to do this unless you're wearing a purse too. And bless him, the person that he is, he stopped everything. He said, is that what the problem? Because he could see that I was getting...
Yeah.
And he said, oh, is that what the difficulty is? And he said, well, maybe would you be willing to wear a fanny pack for a couple of weeks while we get this under control? And I was so instantly like, I'm just an idiot. Yeah. And I was like, okay, all right, yeah, whatever. But I had yelled at him. And I do think we need to talk about that, Vince, that, I'm a out there kind of person. Other people bottle it up or just go, well, I'm not going to be able to do that, and walk away, and don't yell at the person and go, I can't do it that way. My purse is in the way.
Right.
So how can we help parents to fight to get through the intervention and be a part of it? Because that's the only way it's going to work.
I think the first thing that comes to mind is be active in your clinic meetings, your patient meetings. Be active in your trainings. Be active in the advice and the collaborations that you're getting from your supervisors. I think a lot of times I hear, this is a surprise. This is new to me. This has just happened. Where oftentimes it's something that's been discussed before. We've had behavior plans before. There might even have been trainings before. And the parents, while appeared to be engaged, they really weren't as engaged as they should have been. Because it wasn't a problem at the time. We waited for it to be a problem, and now it's a big issue. And that's not just about aggression. It's really just kind of a general making sure that the families, that you guys are actively involved in the treatment, actively involved in the clinic meetings, actively involved in the trainings, so that all along when those behaviors come up, because sometimes the behaviors onset early, sometimes late. Sometimes a child will never show aggression until they're 14, when they hit puberty.
Right. Let's talk about that, because that's a bit of a surprise. It was a surprise to me that Wyatt was upset about something and leaned over and bit me. This was just a couple of weeks ago. But this is common, right, Vince? With a,
Yeah,
with a
I mean,
child in
I wouldn't say
puberty.
common, but it is very, it does happen where
Yeah.
a child might not have demonstrated early onset aggression, and they show aggression later, more towards their teens, more towards their puberty years, because their bodies are changing, their chemical makeups are changing, and now they don't know how to express that change or know how to deal with that change, and sometimes aggressive behaviors come up. But I do feel confident that if the families were engaged they had a very good rapport with their team and a very good idea of their treatment and a very good trusting relationship with their supervisors, they have that platform to reach out to their supervisor. They have that platform to reach out to their team and say, whoa, this is new. How do we tackle it? Not how do I tackle it? Not how do you tackle it? How do we tackle it?
Yeah.
And we need to set that foundation so that all the families have that ability, so that when an aggressive behavior is happening, or maybe it's something that's new, that they have that immediate team atmosphere, that teamwork framework to be able to tackle it. But that's the one thing I see oftentimes when I talk with families that actually have aggressive children. This goes back to what Shannon was saying, that actually have children with aggression. They get used to it, and they kind of disengage from the different treatments and the different interventions that we're trying to employ, that we're trying to prescribe to change it, because they are just kind of getting used to the status quo of how to deal with it. Now, that doesn't, that's where we as the professionals have to make sure we continue to work on engaging the families. And that's where we ask the families to continue to engage in treatment, so that we're able to teach those skills. We're able to keep everybody on the same page and be effective at home when we're not there.
And you and I had a conversation about this yesterday, Vince, and one of the things that you said yesterday that really stayed with me last night as I was thinking about this was that when we have something that's going on, because we had a conversation about potty training too, and you were saying, but this is the perfect example. When we do potty training and we're going to do this big intervention to change potty training, everything else gets put on hold. Not that it's not important, but that we put everything else on hold, and that it's very similar when we look at aggression, that we need to prioritize it, move it to the top of the pile, and not be working on 14 other things at the same time. And I think a lot of times parents feel so overwhelmed, like, we're working on all these things. How will we work on that too? I'm not even going to bring it up because it's attached to all these things, but that's not actually how it goes.
True. The working on behavior has to prioritize. It has to be the priority, because not only it affects the child and their abilities to learn, their abilities to gain new skills, their abilities to generalize new skills, but like you were saying, it's how it affects the family as well. We have to make sure that becomes a priority, because when we decrease their aggression, or we find the appropriate function of the behavior, and we're able to start shifting it to a more functional behavior, multiple things are going to happen. The child's going to be able to learn more. They're going to be able to communicate better. They're going to be able to get their needs met in a way that's socially acceptable. But at home, we're also going to see a decrease in anxiety. We're going to see a decrease in negative feelings that are going on at home. We're going to increase the participation of the family. We're going to increase the achievements and the successes that the families are going to have with that child. So it becomes paramount that if we have aggressive kids, and kids that are aggressing to where it's impeding on not only home life, adaptive life, but their treatment as well, that has to be the priority. It doesn't mean that other things aren't important. It just means this becomes our number one priority. This becomes a thing we have to maintain and get control of first, for everything else under it to be successful.
Okay, so just to recap for a second, one of the components of this is that we need to, even though all of our feelings are our feelings, and I never want to say to anybody, well, stop feeling that, because that's not how it works. But
Sure.
But your feelings are your feelings, but we have to separate feelings from what's fact. And we're going to feel like it's our fault, but that is not the fact.
Right.
And
right. It's not.
And so understanding that it's normal if you're feeling guilt, it's normal if you're feeling shame, it's normal if you're feeling like, well, I don't want to say something because I don't want to stigmatize my child, or have people look at my child in a different way. All of that we can relate to, and I think almost everybody describes those feelings, but that's not helping your child.
Right.
So we got to move through those feelings. We got to reach out, as you said, Vince. Don't isolate. As much as we feel like we want to go in, that's the right thing to do, is go out with all of it. Go to the people you trust, ask for help, ask for support, and then keep conveying information to those people when they're giving you the support about what is working and what isn't working, but don't give up.
Right.
You've
right.
got to be a part of the intervention. You can't
Absolutely.
just walk away. It takes the whole team. There will be support to help you, but you have to be a part of it too.
Right.
And
we can't do it without you. The professionals can't do it without the parents doing the same stuff. And then again, vice versa, right? The parents are looking to us for advice and interventions. So we need to have that relationship. We have to be that family for it to be successful.
You know, one of the things that was hardest for me when Wyatt was smaller and he had more aggressive behaviors was ignoring the behavior. Because that was the antithesis of what I had been taught as a parent to do.
Yeah, there are
Right.
some times when we're told there's something called planned ignoring. You're not
Yeah.
ignoring the child, you're ignoring the behavior. This is a really dicey area because I think a lot of times it's misunderstood, Vince. And then people just start blanket ignoring things that shouldn't be ignored, and blanket ignoring the child. Can you take just a minute to talk about when and how somebody would ignore a behavior and how that would look?
And I think you touched on a very good point, is that this is where you really need to rely on your professionals to be able to look at what the function of the behavior is. What's the root of the behavior? If the behavior is happening because of attentive means or attention means, the child is trying to get the attention of others and they're using aggression as a way of doing that, then one of the techniques to work on it might be a planned extinction or a planned ignoring, right? Because then we're not giving the attention for that behavior, thus we're taking the function away from it. Okay, but that's the only time, well, I wouldn't say the only time, but that's the typical time that we would use that. We won't use it if the child's is using aggression because they need sensory input. We wouldn't use that if they're using aggression because they were trying to attain something. We would, it depends on what the function of it is. So even though for us, the behavior observably might look the same, right? It's a tantrum, or it's a hitting, or it's kicking. The reason why they're doing it could be completely different. So we might have to have a behavior intervention plan for kicking for 4 different functions, right? So we're going to have 4 different ways that we need to deal with that. Now, as you can imagine, that can be very confusing. And that's why we need to be engaged. That's why we need to be active in clinics. That's why we need to be active in our meetings, so that we're all very clear on when he does it for this is what we do. When he does it for this is what we do, and so forth. There's really not one global way to deal with aggressive behaviors. It really is specific to the function of the behavior and the dynamics of that child.
And I really want to encourage people. I got really lucky that one of the first times that my child was engaging in a behavior that I needed to do the planned ignoring for, I had a therapist who was there. And he was a good therapist, and he said to me, I said, you're going to leave now. And he said, no, I'm going to be the voice in your ear. I'm not going to do it for you. I'm only going to talk to you, and I'm not going to talk to my child. And so he talked me through planned ignoring in the moment with my child aggressing at me. And that I really want to encourage you, any of you that have a child that's doing that you are having trouble with that, exactly what Nancy's talking about. If you've been asked to ignore a behavior, say to your therapist, can you do this for me?
Yeah.
Can you talk me through it? I need, the next time a therapist is there when something is happening, this is exactly what I want you to do. I want you to talk me through it, because once you go through that, you go, like a light switch goes off and you go, I get it entirely.
Yeah.
But if you haven't, it goes against every instinct.
It does. It really is a very difficult thing for a parent to handle. And to have that support is great when you can have it.
Yes. And if you've got a therapy team and you say to them, look, at some point it's going to happen in front of you. Here's how I would like it handled, because I need this. I need to know for the rest of my life. It's the best gift you can give yourself, your family, your child, your team. Vince, I know you
some
have to
questions?
go. We have some comments, but I'm going to address them after
Okay.
we have Vince. But Vince, I know that you have to go. We
One more
thank you.
thing, if
Yes.
I can, one more thing just on what Nancy was saying. Remember, it's a lot easier to pacify and avoid the behaviors now, but at the long-term expense, right? It's easier just to give him what he wants so that he doesn't become aggressive, or it's easy to, to put him in another room, where his toys and stuff are, to avoid a behavior. But we have to remember we will still have to deal with it. And as they get older and bigger, they get bigger and stronger.
And
Sure.
it takes longer every time that we
Every
don't address it. But Vince, I thank you so
Thank you,
much
Vince.
as always, and we will be checking in with you next month.
Thank you very
Sounds
much.
good. Thank you, ladies.
Take
Okay.
care.